My name is Sonia Leziy and I'm a periodontist, and I practice in a beautiful part of the world. I live and practice in Vancouver, British Columbia, and I'm one of a group of specialists. We're several periodontists and a couple of prosthodontists and an awesome team behind us. So I thought long and hard about what could I do as an expert tip, because a lot of people in this organization who know me know that I always talk about implants and aesthetics, and I thought I want to do something a little bit different. And I thought, well, what's really meaningful, or what's a little tip or tool that might change how somebody practices? And I went back to kind of some basics, and I thought about things that sometimes we don't think about. So I looked at, I do a lot of implant surgery, and today guided surgery is a big part of my practice. And I'm looking at all these lovely guides that are coming in from the lab that I work with, and I realized that a lot of us sort of empirically decide how are we going to handle those surgical templates when they come into the office in terms of cleaning them, something really basic before they actually go into the patient's mouth. Because we have to remember that guides that come from laboratories, or even that might be made in our own laboratories, are not necessarily coming from a very clean environment, and we want to put something into the patient's mouth that's clean, especially when you're going to do surgery. So I started canvassing my friends, my other periodontists and oral surgery friends, saying, what do you do to clean your surgical guides? And I realized I had a huge array of responses, ranging from, I don't know what we do because that's what my staff take care of, to, well, I put it in chlorhexidine, or I use bleach, or I use a variety of other solutions. So I started going to the literature, and what I found is that there's very little literature that tells us what should we do to our guides. But I came up with 2 articles that suggest that, in fact, just water solution is ineffective at cleaning them appropriately. Chlorhexidine is almost equally ineffective at cleaning our surgical guides. Sodium hypochlorite, or bleach, somewhat effective, but the most effective thing that we could do to clean our surgical guides is to, in fact, place them in isopropyl alcohol, 70 to 80%, ideally for at least 15 minutes, probably in an ultrasonic cleaner. And that is what we can do to more effectively clean them and reduce the potential for contamination. Hope that's helped you in thinking about how you want to handle the plastics that come into your practice.